Perfect, thank you.
Okay.
Good morning, Leanne.
All right,
Tell
so
listeners.
this is the third time this has been
Yes.
done, right?
Yes.
All right,
Yeah.
so it wasn't bad enough that you got through the first, the second. Now you're going for it a third time. This is
Yeah.
amazing.
Yeah.
Yes. No,
Yeah.
we're very happy and very privileged to be able to do this.
And,
Yeah.
and are more and more people wanting to participate in it?
Yes, there's more and more people want to participate in it, Leanne, and I think there's a very good reason for that.
Yeah.
And from Novo Nordisk side, in conjunction with Doctor Van Staden, is that we feel that we have to make a contribution to this global challenge of diabetes. And as a global leader, we believe that we can make a difference through raising awareness and promoting advocacy around diabetes in support of the International Diabetes Federation. You would be aware that next week on the 14th is World Diabetes Day, which has been sanctioned by WHO. So I think in a small way, we in South Africa, in conjunction with Dr. Van Staden and Novo Nordisk, we'd like to make a contribution.
When
towards
does the actual cycling start? Do you do it over World Diabetes Day?
We're going to start on Thursday.
On Thursday?
Yes, we're starting on Thursday and from Rivonia at the Novo Nordisk headquarters, and then from there onwards do some screening along the way. This year we used to go to George, but this year we're going to go all the way to Cape Town.
Wow.
And hopefully finish on Saturday afternoon at the Virgin Active there. And we're going to have 4 testing stations, so we're also encouraging the public to come along. At Molokoane Mall in Soweto, we're going to do some screening, free screening. And also in Kimberley and in Paarl, and then at the waterfront.
How many kilometers are you actually cycling a day?
Well, it's in a relay format, so we're gonna it's four teams.
4 teams.
And we're gonna try and do the 1,600 kilometers in this 3 days.
In the 3 days,
yeah.
with 4 teams. So each team.
Yeah, we'll do about 100
cycles a
kilometers.
day.
Yeah.
So each team will relay every 120 kilometers, and then take over from the next team and go straight through the night.
How many people are you looking at? How many people have signed up to do it this year?
We have 16 people that are cycling this year in teams of 4.
Yeah.
So on average, each team is going to be riding about 500 Ks.
Fantastic. Well, listen, I mean, I think it's an amazing initiative and for a brilliant cause, because I think at the root of it all is what we need to talk about, and that's diabetes. Yeah. How prevalent is diabetes among South Africans?
I think it's a very good question you're raising there, Leanne. The estimates from the International Diabetes Federation last year is there's about 382 million people living with diabetes, and 20 million of those are in Africa. But back to your question, when you look at South Africa, the estimate is about 2.6 million people living with diabetes. And the biggest challenge is that there is a study that came out in 1992, they call it rules of halves. And what it says is that 50% of the people that are living with this condition are not aware that they have the disease. And 50% of those that are detected are not being treated. And half of those that are being treated don't reach control. So, I mean, just to put it into perspective, if you have about 100 patients that are living with this diabetes, it's only about 10% that will be reaching control if treated. So the rest of the people is just an accident waiting to happen. So there's a big challenge in raising that awareness. So that's at the root of this campaign.
Well, it certainly is, and I think it needs to hit home that it is an accident waiting to happen, because some people, like you say, are undiagnosed, have no idea that you have diabetes, and then the next second, your life comes to an end.
Exactly.
How often should you test for diabetes? How should I, as an individual, look into it? What signs should I look for? And how often, as I asked you, should I get tested?
Well, actually all patients with symptoms of diabetes, which is excessive thirst, excessive hunger, tiredness, going to the bathroom often to pass urine, those are some of the common symptoms of diabetes. And they should then go to their doctor or clinic and have themselves screened. But it differs from adults to children. There's type 1 diabetes, which are usually children, which is an autoimmune disease, and type 2 diabetes, which is usually adult onset. And these are usually a lifestyle-related problem. You know, it's the unhealthy eating habits, excess amounts of carbohydrates and starch that gets consumed with lack of exercise. And urbanization is one of the biggest problems of that, and that's why South Africa is becoming one of the biggest leaders in obesity in the world. You know, where other countries, westernized countries, have started to reduce their obesity, you know, and we actually inclining, and that's why we're trying to make people aware of it and to try and prevent it, because it is preventable. Type 2 diabetes, type 1 diabetes. These kids are dependent on insulin, and they usually test their blood sugars 4 times a day and need multiple daily injections with each meal. But it's the type 2 diabetics that have the highest cardiovascular risk for blindness and multiple complications that can be prevented when managed properly.
I know that, I mean, a lot of people talk about your waistline. That's something that you really need to curb. You have to control that. It's one of the indications of being unhealthy, being diabetic in a way. Is this a fallacy, or is it true?
No, it's true. The central obesity is a big problem. So if someone with a raised body mass index and a waist circumference with a BMI usually anywhere above 30% has a higher risk of being a diabetic. But it's also multiple other factors that play a role with that. And also it's more the apple shape than the pear shape obesity type, which is
the round shape.
Yeah, it's
that round.
It's that belly. It's that belly. The belly fat. That central obesity, which is a big problem,
which is a worry,
and which causes insulin resistance, and especially type 2 diabetics.
Well, it's something we all have to watch out for, but at the same time, we need to watch out for you, because are you taking part?
Yes, but
you
I'll be flying.
I love it. Okay, so you'll be there, but in a different way. I like your way. I like your style. I think that's a great style. Okay, so there are going to be testing stations. We've told you about them, but let's just end off the interview, because I think we need to tell people one more time. Those testing stations, where exactly are they going to be along the route?
The first station is going to be at Molokoane Mall in Soweto.
Yeah.
And then we'll be proceeding to Kimberley. There will be testing there. We will test in Paarl, and we'll finally test at the Vision Active in Cape Town.
Fantastic. So that's the route. That's where the testing stations are going to be. This all starts next week, Thursday.
No, this week
Thursday.
This week, Thursday?
Tomorrow.
You're joking. I thought this is next Thursday.
No.
So this is tomorrow.
Yeah, it's tomorrow.
Guys, good luck. This is amazing. Okay, so it's happening tomorrow, and here you are. I thought you'd be practicing. You don't need to, I suppose. You don't need to do this.
We're ready.
Thank you. Good luck.
Thank you, Leanne.
We really wish you all the best, and I hope this just raises all the awareness that we do need. Okay, so joining us here in studio, Doctor Van Staden, the founder of Team C4D, and Tom Molokoane from Novo Nordisk, and talking about the diabetes. All right, let's take a break.